All right, good afternoon. It's Monday at 4 o'clock, time for our COVID report, specifically dealing with this surge in the Delta variant. Toughest news that we'll hear today is between our Saturday, Sunday, and Monday reports, we have 88 new deaths. 86 of these have occurred in the last 6 weeks, meaning that individual passed away in either August or September. And it brings our total number of deaths due to this pandemic to 8,339. Far, far, far too many. On Saturday's report, we reported 3,811 new cases and 48 new deaths. I'm going to read just some of the ages and the counties, and I will tell you that this will be hard today because many of these are much younger than we're used to. Saturday's report includes a 23-year-old man from Bell County, a 41-year-old man from Bell County, a 22-year-old, it's hard to call that individual a man, a 22-year-old boy from Carter County, a 44-year-old man from Christian County, 48-year-old man from Grayson County, 43-year-old man from Greene County. And many individuals on this report also in their 50s, a 50-year-old from Whitley County, a 54-year-old woman from Powell County, a 57-year-old woman from Ohio County, 51-year-old man from McCracken County, a 56-year-old man from Greene County, a 50-year-old man from Callaway County. I missed a 45-year-old man from Boyd County. Just tragic. Sunday's report, 2,685 new cases of COVID-19, 23 new deaths. And we're seeing lots of deaths in counties that we wouldn't necessarily expect to. I mean, Sunday's report has 4 deaths from McCreary County, all since August 25th. 5 deaths in Taylor County, all since August 27th. The report includes a 36-year-old woman from Bullock County, a 22-year-old and a 47-year-old man from Jefferson County, 46-year-old man from Pulaski County, 48-year-old man from Taylor County, and 2 people in their 30s, 2 women in their 30s from Whitley County, ages 36 and 39. And again, others in their 50s. 51-year-old man from Jefferson, 52-year-old woman from McCreary, 55-year-old woman from McCreary, 56-year-old man from Scott County. And then there's today's 2,075 new cases of COVID-19, 17 new deaths, including a 37-year-old man from Bell County. A lot of deaths we've seen in Bell County over the last 3 days, at least reported. A 36-year-old woman in Lewis County, and 4 individuals from Nicholas County. Just very tough reports. As of today, positivity rate 12.18%. That has dipped slightly. Remember that we were only over 12% once we had enough testing in this pandemic once before the current surge. So while that's not 14 or 13, which is better, it is not good because it's still far too high. Let's look at our stair-stepper chart by COVID cases by week. So again, this is better than 2 weeks ago or 3 weeks ago, but this is still our 3rd highest week of cases ever in the pandemic. And remember, each case that we have with the Delta variant is more serious than the Alpha or original strain that we faced earlier in the pandemic. So while we hope that this is a trend and or a plateau, we cannot sustain a plateau at this level with the number of people it would put in the hospital. It's simply too many cases. And if we look by the date when a test confirmed someone had the virus, August was the most cases that we have ever had in the pandemic at 104,000 cases. That's not when we report it like I did today with those numbers. That's the date they would have tested positive, but it does make August the worst month ever in the pandemic in terms of cases. This is just showing the surge in the Delta variant. Remember, not last week, which is the first bar to, I guess, your left, but the week before was the Labor Day weekend, and fewer people got tested, and we thought that dip was due to fewer people getting tested. I think that's accurate now. We will see what we have in this coming week from where we are from a trend. We certainly hope that maybe this shows us that cases aren't going to continue increasing, or certainly not at the rate that they were. But once again, I want to make sure we don't view this as good news, because a plateau will continue to push our hospitals over capacity. Far too many cases. Positivity rate, again, if you look at the second bar from the end, that was the Labor Day week where too few people got tested. That can inflate the positivity rate, just like very early in the pandemic. So during the Labor Day weekend, people were just going to get tested if they really felt sick. This week, obviously, much lower, or a little bit lower. Again, still higher than any time, but the worst week in the winter surge in the pandemic. Could be a function of a couple things. Again, could be more of a plateauing, but more people getting tested. More people get tested pushes down the positivity rate, but that is a good thing. The more people get tested, the more people know if they have COVID or not, the more we can contact trace and ultimately isolate that person. So whether or not we're starting to see our positivity rate as a trend actually decrease, or whether more people are getting tested, that's both, I think, a positive. Let's look at the trend by week. Again, a little too early to tell exactly what this means, but whether it's the extra testing or the start, we hope of, we would hope it's the start of a decline, but way too early to suggest that. Again, something that we should watch as we go forward. Total inpatient census for our hospitals. While it looks like we are decreasing slightly, sometimes this happens on Mondays, but this is a couple of days. We could be maybe a little hopeful on this. I do think that we are seeing a lessening, at least in the increases that we saw in hospitalizations, but that is, again, too high with the number of cases that we currently have for us to sustain here in the Commonwealth. But we want to see that to continue to go down. Intensive care in the ICU, this one looks like it is potentially leveling out, plateauing, but this is with, on any given day, between 90 and 120 total open ICU beds. So you could see how, with a major staffing shortage or an outbreak of COVID in a hospital or others, how that could be really problematic. This is also with so many ORs and other locations in hospitals converted into ICU space. So if we plateau here, it means that we are not being able to do so many of the outpatient or other procedures that people really need for other health conditions. And then we look at ventilator census. While the ICU is gone up and down a little bit, but maybe remain flat, while it's possible that we're seeing our hospitalizations start to decrease a little bit, this one's really concerning. People that go into the hospital are getting sicker than ever before. We just got a bunch of new ventilators from the state, brand new. We've been deploying them, and the amount we got from the National Strategic Stockpile all over the Commonwealth. And as I start my day every day with the situational report from hospitals, and it hurts to see that a hospital has every single person, every single ventilator in use, and we have to send them more. That's a trend that we want to reverse. Saturday was our worst day thus far for number of hospitals reporting critical staffing shortages. We were up to 77% of all of our hospitals with 74 of 96 reporting it. As of today, we're down a little bit on that with 63 reporting it, but still that is over 2/3 of our hospitals reporting that shortage. As of today, we have confirmed 21 kids in the hospital, hospitalized because of COVID, 7 in the ICU. But remember, this is a count from pediatric ICUs. Kids and adult ICUs, which they've had to do, aren't included in these numbers. We've had at least 3 new hospitals apply for FEMA nurse or medical strike teams. We'll see as that moves through, but the ones that are critical in their staffing shortages, some it has gotten worse and worse and worse. I think in each of those hospitals, we do have National Guard assisting right now. First report on monoclonal antibodies and the rationing from the federal government. I don't know if we have the slide from last week, but last week we gave out over 5,000 monoclonal antibody treatments. And as you remember, that number has gone up significantly week over week. We'd be doing 5,500 or more this next week. We're only going to receive 4,960 this week, and it's going to go down from there. We were able to allocate them to 79 sites around Kentucky, and those were based on back-ordered requests, reported on-hand inventory. So if you had enough to get through the week, we were sending it elsewhere, and reported previous week utilization. So what's going to happen is sites are going to have until Monday close of business each week to request an amount of monoclonal antibody treatments. Then we'll have to look at the needs across the state and ultimately take the amount that we are allocated from the federal government and ration that out. What that means is we will meet the legislative intent of having at least one provider in each of the area development districts, but there's not going to be enough anywhere. There's going to be too few everywhere, and we're already seeing hospitals and other providers run out before the end of each week. What it's also going to mean is to be a part of this program, since we've been asked to have sites that people know about. We hope by next week we're going to begin publishing the information of who has them and where. And yes, this is going to lead to a lot of people calling them, but the people of the Commonwealth also deserve to know where this medication is. But I want to say it again, there's not going to be enough. And if you're putting off a shot, a vaccine, to have an infusion, first let me tell you, an infusion is a lot more invasive. I know those that don't like the vaccine call it a jab in the arm. Well, I mean, chemotherapy is a form of infusion. It is pumping things through your body. So I would say, please, knowing that there's not going to be enough anywhere in the Commonwealth, get that vaccine. Get it because it protects you. But I tell you what, if you have another family member that doesn't want to get vaccinated, if you do, it makes it more likely that treatment is available for them. And we're seeing whole families get sick and need treatments. You know, when the original variant or the alpha variant was out, somebody in a household would test positive, but the other people wouldn't necessarily be. Now it's everyone, and we're seeing, you know, mom and dad and maybe aunt and uncle and others all need the monoclonal infusion. Imagine if you show up, because this is a very real possibility. It's going to happen. And both of your parents need it, and there's only enough for one. What's a doctor supposed to do there? What's a family supposed to do there? If you can get at least one of those individuals vaccinated, they most likely won't need it, and that'll mean that there is enough for others. So we've been seeing the toll that the latest surge of COVID-19 is taking on our healthcare heroes. Even though they're overwhelmed and exhausted, they continue to fight. And it was heroic before when they were walking into to these COVID units. And remember, for those that don't want to wear a mask, have we seen the videos of what they're wearing when they walk into a COVID unit? I mean, they look like they're walking on the moon. That's what it takes to be safe around someone with COVID. Wearing a mask is real small compared to that. But we thought it was real heroic earlier when they were doing it, and it was. But now, being overwhelmed, seeing this amount of death, they keep going in. And so their heroism now isn't just about courage, it's about resiliency. And you're going to hear about that today, because the team at Baptist Health Corbin continue to fight for those suffering in their community from the deadly virus. So today we're joined by Sherry Mays, Vice President and Chief Nursing Officer at Baptist Health Corbin, via video to speak about the burden her nursing staff bears in this latest surge. If you remember, she joined us in person just a few weeks ago, but things are even worse than they were then. And I mentioned the word trauma. Trauma that families go through when one of their loved ones is on a ventilator. But there is real trauma these healthcare heroes are going through. They're going to carry scars on the inside from this period. They know it, and they still show up.
This is like a war zone to us. We have staff members who have experienced PTSD just as a soldier would in the time of war. You think when you go into nursing, you're going to take care of patients and your patients are going to get better and you're going to send them home. Well, that doesn't always happen with COVID. We have many COVID patients who pass away, and we've done everything that we can do. And it wasn't good enough to send those patients back home. I think we had 4 deaths this weekend, and that's difficult. My heart breaks for my staff. Honestly, it does. I see them out there working every day. And they've put this hospital and the patients ahead of their families so that our patients could be taken care of. And that's probably one of the hardest things for me, is to watch my staff work like they do and give their best. And I have children that are on the front line. My children are in healthcare. So I do know what that's like. So, that's why we feel like if you have the vaccine, your case is going to be milder. You can't think that this is just the flu and you're going to stay home and take care of it. It's COVID, and we have to address it early on.
So let's remember to think about those incredible human beings. I think the PTSD, you can hear and you can see it is real. They know it, but they're going through it for us. The least we can do is get a vaccine or wear a mask to try to help these individuals just a little bit. On the vaccine front, since over the weekend, 13,752 new people vaccinated, to bring us to 2,652,144 Kentuckians that are currently vaccinated. Before we do that, I think we now have 5 counties, over 70% of all the county, and that includes people that aren't eligible, still in there, over 70%. Woodford and Franklin, 76%. Fayette County, 73%. Campbell County, 73%. Boone County, 70%. So good job there. We look at this both demographically by age as well as across the country, across the Commonwealth geographically. So let's start here. First, of all Kentuckians, we're getting real close to 60% of everybody vaccinated. And now 70% of everyone 12 and older, 70% of everybody that is eligible to take this vaccine has taken at least one shot. And with everything we're going through right now, we're focused on not enough people being vaccinated. And that's the power of this Delta variant. Getting 70% of a Commonwealth vaccinated against a brand new virus is a big feat. And it's taken a whole lot of work. And I want to thank everybody out there that has worked on it. What we've learned with the Delta variant is this is not enough. But I don't want that to take away from those that have worked so hard to get 70% of those eligible vaccinated in less than, we started to do this in December, less than 9 months, and we really didn't have 10 months. We really didn't have all that much until January or February. So to everybody out there that's working, good job. We need a lot more, but good job. 18 and up, those that can make the decisions fully on their own, 72%. All right, so as we break down age groups, no change in 65 and up, and no change in 50 to 64. We'll come back to talk about boosters and the recommendation that will go to the CDC for 65 and up. 1 point gain, 40 to 49 and 30 to 39, now 69%. 40 to 49, that's a good job. Keep going. That's my demographic. 30 to 39, 63%. Again, that's below the total average for 12 and up. 18 to 29, just half. And then 12 to 17, again, we need to do a whole lot better there. And let's remember how many people I read today, 18 to 29. We've never seen that many 20-year-olds. Not on one report, certainly not on 3 reports. Talking to one of my staff members, one of our team members, talking about her brother finally getting vaccinated because he knew someone in their 20s in their place of employment that passed away. This is very real, and it's happening all over. Let's go to geographically. If we can, let's start at the 40% and up. This is the last week we're going to show this map because 40% isn't anywhere close to what we need in a county to provide protection. So we're going to move this starting next week to 50 and 60%, and we're going to go up from there. But counties that did not have 40% of their population vaccinated that crossed the threshold, Cumberland, McCreary, and Greene. So first, good job on the improvement. Keep going. That still means that 6 out of 10 people in the community haven't gotten a shot. I'm sure not all of them eligible. Some of them are too young, but please keep pushing. When we go to 50 and up, again, to defeat the Delta variant, we need to be able to show one that's 60, 70 and have virtually every county in it. But crossing the 50% threshold, Logan, Simpson, Mason, Rowan, Greenup, and Letcher. So please keep working. And again, the focus has been on getting more people vaccinated. It's got to be on getting more people vaccinated. But I want to step back and make sure we acknowledge how hard Kentuckians have worked to get people vaccinated. When we look at the vaccine tracker, and let's even move from the 1 shot to the 2, to the fully vaccinated, where we're not at the 59%. Instead, we're at 51% because there's a certain amount of people that haven't had the chance to go back and get their second yet and or didn't go back. When we look at the entire United States, first of all, the fact that our color is darker than all of the South but Florida, and darker than Indiana and West Virginia and Missouri shows you that we have outpaced virtually all of the South in our efforts to get vaccinated. In fact, we're 8, even 10 points above, percentage points above some states to our south. But if you look just directly at our neighbors, we're actually third amongst all of our contiguous states. We lag behind Virginia and just barely, just 2 percentage points behind Illinois, but ahead of Ohio, Indiana, Missouri, Tennessee, and West Virginia. And in fact, the difference between us and the least vaccinated of our neighbors is 10%. So I do want to say that while we're very focused on getting more people vaccinated, which we have to in the midst of this incredibly deadly surge, I want to express my gratitude for all the work that people have put in. And if you look at least 1 dose, we're third on that too. I think all the states stay in exactly the same order. So we want to keep this up. We want to catch up to Illinois. We'd love to be where Virginia is. We just got to keep working each and every day. And the reason we got to work is vaccines offer a huge amount of protection. When we look at vaccination status of cases, hospitalizations, and deaths, 87% of all cases since March 1, unvaccinated individuals. Now, most of these cases that are of vaccinated individuals have been pretty harmless. The reason we know that is because there is a difference between that 87.1% and then the hospitalizations. 92% of everyone going to the hospital for COVID, unvaccinated. Think about the numbers we've had of people in the hospital, thousands, right? And how sick they are. 92% all unvaccinated. That means that your protection against going to the hospital for the most deadly virus of our lifetimes is incredible. I mean, the protection is incredible. And when we look at deaths, 84.6% of all deaths since March 1, unvaccinated. We believe that these boosters for the immunocompromised, which you can already get, and once we hit 65 and up, is actually going to have a very positive impact on that. We think that there are a significant portion of the breakthrough cases where the vaccinated individual ends up passing away from COVID are folks that a booster will help them fight that off, and we will see less outcomes in that way. And then we look at rate of COVID-19 cases by vaccination status. I think this is the first time we've been able to put up September in any detail. It is holding, if not improving a little bit with August in the amount of protection that the vaccine provides. 4.5 times more likely to get a case of COVID if you are unvaccinated than if you are vaccinated. And that is, again, better protection, albeit against a more difficult adversary than at the very beginning of the vaccine program when we were fighting the original or the alpha strain. All right, let's give a quick update on boosters. So where we are right now is that the FDA committee has met and taken a preliminary vote on boosters. Now, this is not the third shot for immunocompromised folks. If you are immunocompromised, fall into those categories, you've been able to get your third shot. And a number of people have, and you should, with those serious health conditions. This was who else amongst the population is going to be able to get a third shot. And it's mainly the thought of, for healthier individuals, when should you get it so that your immunity doesn't wane and you can fight off the Delta variant or any others. So right now, only Pfizer has submitted information. Moderna and J&J will come, we think, soon. And remember, the FDA, when they meet, is only the first step. They make an advisory opinion or give a recommendation that then goes back to the CDC. So here's what happened. They met and they considered lots of options, from everybody getting a third shot 8 months after their second. But what they ended up deciding to recommend is approving them if the CDC says yes. So they're recommending them would be the right terms for individuals 65 and older, individuals at high risk for severe COVID-19, and also, and they put this in, people in high risk professions. So the CDC has said, we haven't looked over the recommendation. We will. They're going to meet September 22nd to 23rd to look over that recommendation, and then we hope make a decision. As we look at the data, first of all, this will be a really good thing for individuals over 65. We think it'll provide a lot more protection. And it's going to make it significantly easier from a logistical standpoint that they're at least going to do this group first. So there's about 560,000 Kentuckians we think that'll qualify for this. And I think this is only a first phase. We definitely think that boosters are coming for others. But we have enough vaccine available in our pharmacies and in our current providers to do this in a month, potentially even less if everyone who qualifies when and if it becomes adopted wants to show up and get it. And I think that's ultimately will really help in getting those individuals in that area, that booster. And then best news that you could tell dad of a child under 12, COVID vaccine prompts strong immune response in younger children, Pfizer says. So again, this is just Pfizer. It has submitted, or it is submitting, its very first clinical trial information to the CDC. It is going to seek emergency use authorization. At least it appears thus far that it is safe for kids. and it does promote a strong immune response. It is 1/3 of the amount of vaccine as the adult version of Pfizer. Remember, Pfizer is less than Moderna. Very excited about it. I think a lot of parents have been waiting for it. And I think it is a key to being able to do school in person, to not have these interruptions that we've had, even in universal masking. It is a big day. It cannot come soon enough. I want them to be deliberate. I want them to make sure it is safe. But good God, I'm ready, and have been looking forward to the day that my daughter can have the same level of vaccine protection as my son. All right, let's talk about testing real quick. First of all, we're getting a certain amount of Binax now. These are very rapid tests. We're going to be using these on transient and difficult to track populations, things like homeless shelters and others where you need we're also going to use it in jails and in prisons where you need a very quick response to know whether or not to mix someone with the rest of the population inside of that. If we have extras, I know that universities are interested. If we have extras, we will try to make those available. But I want to talk through K through 12 testing. One of the things, in addition to the monoclonal antibodies that the legislature mentioned. I'll go through this quickly, but all the information is available to view by visiting kycovid19.ky.gov and then selecting KDPH guidance on the tab and then selecting school child care guidance on the drop down. So let's go through that again, just so those know, because the website's getting pretty full. So this is the very top of the page. That's the guidance button to click, and then go to the next one. All right, and then that is the school early care guidance. So we've done a couple of different things. First, on the testing side, again, we've contracted with 19 labs to offer COVID-19 testing in K through 12 schools with no cost to the school itself. The service is available to schools in all Kentucky counties, though it's the responsibility of the school or the school district to set up a testing program for their school or their community. They can call any of the 19 if those 19 can service that county, and it is free. What they can't do is call somebody that's not on that list because it was bid out, and then come to us and ask us to pay that group to do it. This is a program that's been set up. All the tools are there. We've also issued guidance on using layered prevention strategies to reduce transmission of COVID-19 in schools and to help keep students physically present in their classrooms. This is the Swiss cheese model of our disease prevention. No single layer is enough, but when used together, they've been shown to be effective. I think we have a slide on this one. Critical layers of prevention include vaccination of all eligible students, teachers, and staff. That's what we should really strive for. And universal masking indoors, which is also necessary. Masks have been proven to be one of the most effective measures to reduce the emissions of virus-laden respiratory droplets and aerosols. You can tell Dr. Stack wrote these. The universal masking strategy is necessary to protect the most vulnerable, particularly when community transmission is so high. But even with a layered prevention strategy, again, this is, you can't just say, I remember there were times during the pandemic that we're going to use hand sanitizer. No, you need as many people vaccinated, and then you need masking, and then you need some physical distancing. All these things work together. You need better ventilation to slowly and methodically reduce the risk. So we have new guidance up, and it's really streamlining what we've had in the past. 2 schools on this multi-layered approach that reduces the risk as much as possible. Again, number 1 tool, vaccines. Number 2 tool, masking. A number of other tools that are really important. We've also issued new guidance for the test to stay modified quarantine strategy to allow students who are exposed to other students with COVID-19 at school to continue attending as long as they receive repeated negative tests for COVID-19 do not have symptoms, and everybody's wearing a mask. The guidance provides details about the type of testing, the frequency of testing, and when modified quarantine is an appropriate action. Although the CDC does not yet recommend test to stay for schools, studies have shown that when coupled with universal masking, which is a requirement, and other layered prevention strategies are implemented, the risk of spread in schools can be lowered to what we hope is an acceptable level. So the CDC is currently working with school districts to evaluate the effectiveness of test to stay, and our recommendations may be modified when their studies come out. All right, so going online, looking at all of those, what you'll see is again, very clear guidance about all the different types of prevention strategies, a number of pages, but going through vaccination, masking, physical distance, screening, testing, ventilation, hand washing, isolation, quarantine, and contact tracing. And also making it clear, because different groups have done different things, what the quarantine time should be, and the big difference between if you're vaccinated and you're unvaccinated and you're exposed in school, what you have to do. If you are vaccinated and you have no symptoms and you're wearing a mask, it means that you can stay in class. To me, that means my student should be vaccinated, should be wearing a mask at all times, and that means they can stay in class. All right, one last piece, and this is the one non-COVID piece that we will have today. So as the governor of the Commonwealth, I am committed to protecting not only the health of our citizens, but also the safety and security of them, including our state employees who work on these Capitol grounds, as well as those who come to visit. Our Kentucky State Police do an incredible job of providing proper security on our Capitol grounds, but we must ensure that they have the proper measures in place to protect those who protect us. For over a decade, groups like the Secret Service and the FBI have been recommending that we make some security changes to the Capitol grounds. One was a fence around the mansion. They've been recommending that for a long time, and at that so-called militia rally, we saw a good reason why it needed to be there. And I'll tell you, on behalf of my family, it needed to be. So today I'm announcing another enhanced security feature that will soon be coming to our Capitol campus. Upon recommendation of the Kentucky State Police and federal security partners, the Finance and Administration Cabinet's Department for Facility and Support Services will be seeking a request for quotes for the installation of bollards on the grounds of the Kentucky State Capitol. What those are going to do is they're going to be installed at the east and west ends of the portion of Capitol Avenue that runs in between the Capitol and the Annex. That current road is going to end up closed to traffic. It has been reviewed as a security concern and as a threat for being far too close to both the Capitol and the Annex. And legislators have been briefed. Security groups have been consulted. This is one where we want to do it before there is a tragedy and not wait until after. On the positive side, we think in the long run, it gives us an opportunity to create an incredible green space between the Capitol and the Annex, where we can host functions, where people can come and voice their First Amendment rights, but to do it safely. And that we never see something like, for instance, we saw in Charlottesville, where there are demonstrations where a car can get in or get through. I do believe that long term, this is going to be very healthy for these Capitol grounds. I know the change is never easy, but this is one that protects everyone, including the visitors that come here to the Capitol. After what we saw on January 6th at our U.S. Capitol, we've got to be proactive and making sure that everybody here is safe. And this is one important step to making that happen. We ought to expect it to be happening here pretty soon. and the contract will be awarded. We hope after it is out in short order, and we'll all be safer for it when we're visiting the Capitol or working here. All right, with that, we will open it up for questions. First, we got Drew.
Thank you, Governor. You have been giving warnings for several weeks about the very real possibility that people in Kentucky seeking care for un-COVID-related health issues might not find a place. Have you had any confirmed reports of deaths as a result of people not being able to access care? And is that something that you all are tracking or plan to track?
So we have. I do not have reports of deaths unrelated to COVID that were caused by lack of care. You do see things on social media. You do see concerns. Certainly, what we know is people are having to wait a lot longer to be seen, and there are folks that have some surgeries that they really need that they are not getting during this period of time. I think to get to those numbers, it's a longer term thing where we'll have to look back and the delta, the differences in what we typically see in years. You're going to be able to attribute to delay of care. So I don't know how we necessarily track that, but it's going to happen. I mean, it's absolutely going to happen. I mean, if you're living in the Moorhead area and they are absolutely full of COVID patients, unless you can find a way in otherwise. My real concern is not just the heart attacks or the strokes that we think about. Think about timing with the stroke. How quickly you can be seen and how quickly you can be cared for has a whole lot to do with the outcome. But I worry about that bus accident, right? Where you're pulling people up to the emergency room, and are there enough people to see them quickly enough? Tom.
Governor, I'm still kind of going over in my head the bollards that are going to be going up over here. This is going to make things difficult for people that like park in the large surface lot there. They're going to have to go behind the annex, so they're going to have to, because that's one way.
So parking here at the Capitol, we think will be generally unaffected because there are two different ways to get into the parking garage. There is both going around the annex, which just adds less than an eighth of a mile, as well as coming into the parking garage from down on that river road. We believe that people will adapt pretty quickly, but the other part of our calculus is when we're trying to prevent what could be something real tragic, and it only takes one person for an act of hate or violence. We're not one of those capitals that is out there on its own. We're in the middle of a neighborhood, and the safety of the people who live around here is also critically important to us. Chad.
Fayette County Schools, they're in the process literally right now of announcing their pilot program for Test to Stay. Can you talk a little bit more just about how this could potentially be a game changer in terms of keeping students in the building and not having to quarantine if they don't have to? And do you have some concerns about how this process will play out in other districts?
So the Test to Stay model, I think, is one that can be effective, but only in districts that embrace universal masking and enforce it. Test to Stay without universal masking is having people there without a mask spreading the virus before they would test positive. It can't work without it, but with it, especially effectively in a single school. It's going to be hard in a district as big as Fayette County, but in a single school can certainly keep kids in the classroom, especially where they've been diligent about wearing their masks. I've seen that in my kids' schools, where while some kids have tested positive, others in the class have not because of the mask and it being able to cut down on the 3, 4, 5 days that the students around them might miss. I will say, while I'm eager to see how that works, a fully vaccinated classroom is more effective than a Test to Stay model. So if you've got a full classroom of 12-year-olds and somebody tests positive, and everybody's wearing a mask and nobody's symptomatic, they don't even have to test, though you should after a period of time. I mean, they don't have to test to stay. They can just stay. Mike.
I know vaccinating is obviously the whole priority right now, but how much credence do you give
natural immunity. And I asked that because Dr. Fauci was asked last weekend, and he said that's something that he got deeper into the data. And then the former FDA Commissioner, Dr. Gottlieb, said immunity conferred by prior infection is proving to be more robust and protective than previously thought. So what are your thoughts on that? And is there any way to track this data?
It would be challenging to track natural immunity in that we would have to take everyone with a confirmed positive COVID test. But remember, some of them have gotten it twice. What we know is that the CDC did a study here in Kentucky, and it showed that those that had COVID and got vaccinated after were 2.5 times, I believe, better protected than those who did not get the vaccine afterwards. So what I would say is that we take the 2 shots, right, to improve how protected we are. If there's a study from our state that shows you are better protected getting the vaccine afterwards, then get it. And remember, everything that we're talking about right now is against the current variant or what we've seen with the Alpha and the original. We ought to be preparing ourselves for a level of immunity that can take the next variant that comes. I mean, we thought, or some people said early on, that just having the original strain would protect you later on. And we see a ton of cases where people have now had it twice because of the Delta variant. So with a study here in Kentucky, get vaccinated. And that way you are better protected. Karen Czar, WUKY.
Governor, you touched on this briefly, but can you give kind of the feeling you had this morning in your family when you heard the Pfizer news? Because you've been very open about concerns for your youngest. And what message do you have to parents and guardians who, even if they've been vaccinated, are a little bit nervous about getting their children vaccinated once this does get the emergency approval? Thank you.
I was thrilled to see the breaking news this morning about Pfizer's initial results from kids 5 to 11. I stayed on that treadmill 10 extra minutes to hear all the news, which wasn't bad for me in any way, but elated. Getting to tell my daughter about the initial news, getting to see how excited she is. I mean, every day I think about the exposure that I have that I could take home, knowing my daughter can't get vaccinated yet. In the decisions we make, how we conduct school, thinking about the fact that just like my daughter, thousands, tens of thousands of other kids too young to get vaccinated. And to those that have a child that can get vaccinated, please take them. I love my kids more than life itself. I would give my life for them any day of the week, any minute, in a nanosecond. I mean, they changed my life in ways that are hard to express and give it meaning, even on days that they frustrate you more than you ever thought might be possible because you love them so much. I took my son to get his vaccine. I would never, ever take either of those children to anything that would harm them. I will take my daughter to get her vaccine the moment that it is available. It is safe. It is working in kids. And when we have, what do we have, 4, 5 kids in their 20s die in the last 3 days, at least reported in the last 3 days, I don't want to see this impacting anyone younger. And the way we make sure that doesn't happen is to get them vaccinated. Corinne Boyer, WEKU.
Hi, Governor. Are FEMA strike teams readily available to help hospitals that need them? And are hospitals ever denied that help if there aren't enough strike teams to go around?
There aren't enough strike teams, and we have already had hospitals turned down. I think when the original group applied, there were 5 of them, maybe even 6 of them. St. Clair got a yes. Another hospital looked like they qualified, but they did not have a team available, and the others were turned down at least for that period. Now, this happened right as the hurricane had hit when we were supposed to get them. That may have impacted the availability of the strike teams, but they were also south of us, where they had been hit harder earlier. So we may see these strike teams kind of migrate north as they are freed up. So we hope we will see more. But oh no, we've asked for a bunch. We've gotten every EMS strike team we've asked for, and they've been really helpful. We've only gotten one of the medical strike teams, and I don't want to blame the federal government for that. It's a limited amount of people, and we're all struggling. But we can certainly use some more. Debbie Yetter, Courier Journal.
Hi, Governor. Senator Stivers last week mentioned the possibility of a one-day special session to deal with aid to hospitals and nursing homes for staffing shortages. Do you foresee that as a possible, or calling the legislature back for any reason anytime soon?
As of yet, no senator or representative has asked to meet with me. No one has presented me with a plan on it. If what they're referring to is, what was it, Senate Bill 7, it was introduced on the last day of the special session, and it attempts to appropriate dollars that don't exist. And when you look at the bill that did appropriate from ARPA, it was $69 million. It showed you where it came from. It went down to what had been appropriated to pay off the UI loan, and it cut that by $69 million. And it then appropriated those dollars to help in the fight against COVID. That's because the amount of ARPA funds we got went into a bank account, right? And there's a certain amount of them there, and there's no more than that at the moment. These extra funds they're talking about, they don't exist. We don't get more until the middle of next year. And I think he said, well, here's an email where someone said there might be some. No, this is accounting, right? The dollars are either in the bank or they're not. And the General Assembly has appropriated every dollar of ARPA funds that we have. Now, we have been working with hospitals to provide, whether it's in reimbursements, settling lawsuits, providing the National Guard twice, doing testing, and the rest, hundreds of millions of dollars of assistance and or extra reimbursement that go there. And we're going to continue to work with them. But here's what I want to make sure that we don't do, that we don't just proliferate an arms race. And here's what I mean by that. If a hospital's paying somebody $45,000 and the staffing agency is paying them $55,000, and because of that, they're losing people. Well, if what we do is the hospital gets extra amounts to pay them $55,000, then the staffing agency is just going to pay them $65,000. And how is the staffing agency going to make up for it? It's going to charge the hospitals more money than it is right now. With the result could be even worse for us. These hospitals are getting gouged. And I hope they've asked, the only actor that can act in gouging is the Attorney General's office. I really hope that they will look at it. But we've been working hand in glove with hospitals, especially the hardest hit. And right now, there's certainly not agreement between both chambers, but to have a special session, you should have to sit down with the governor and actually talk to him about it, or her about it. Al Cross.
Thank you, Governor. To stay on the same line, Senator Stivers also said that the school districts proved that they were a lot more responsible than you thought they were, because so many of them are keeping universal masking. Were you surprised at the number of districts that decided to keep universal masking?
Well, to say the General Assembly was successful because most school districts aren't requiring universal masking is like saying that they'd be successful if most kids weren't neglected. So what we've got is at least 6 school districts where the kids are in huge amounts of danger, and the districts don't have the courage to do the very basic to protect them from a very aggressive disease. When I had the ability, 100% of school districts were doing universal masking because it's the right call, and I had the courage to make it and not simply hand it over to others that are exposed to significantly more pressure. It's unfortunate that the school boards are associated to a lot, are impacted by so much pressure that's out there and attempted bullying that we see out there. But they are. That's just the reality we face in the war we're in. And when you had one individual ultimately that could make the call and take the heat, which I was in the end willing to do, I'm not going to say I was happy to do it, I was willing to do it. We had 100% of our students that were protected. Now I am heartened by the fact that this many school districts are currently masking. But my concern, Al, is we know that red is dangerous. Well, orange is dangerous too. And if a county moves down to orange, they still need universal masking. But we know that the way the pressures will work is you will lose districts that are there when we desperately need them to keep the masking if they are in the orange because of the danger that's there. So this thing isn't fully written yet, but you know, if you're going to ask to have the ball, if you're going to ask to go in the game, you know, you got to be willing to step up and make the decisions. But I will say, especially on the House side, I do think that they worked pretty hard to prevent worse legislation, to continue to allow businesses and school districts to make tough calls if they are willing to. And certainly there are other state legislatures that went in a worse direction. And to much of the session, with much of the leadership, there were real open lines of communication. You know, they're in one chamber turned into an airing of grievances kind of in the middle of it. I think we had too much downtime and the train seemed on the tracks and then it just seemed to jump off. And that seems to be continuing at least a little bit. But I mean, the pressure of leading in the midst of a pandemic is significant. And, you know, how you react to it can depend on the individual or the day. It's a heavy burden. What I'd ask is that everybody breathe and we try to be the best adults that we can. Zach Hawk from WYMT.
Hi, Governor. Can you tell me what steps can be taken to make sure that vaccine hesitancy specifically to the COVID vaccine, does not spread to other recommended vaccines?
Wow, that is a really good question. First, other vaccines, for the most part, are mandated and have been for a long time. In fact, they're written into state law and have been passed into state law. And we have been taking them, most of them, for decades. Most of the living population has taken just about every other vaccine that's out there. But, you know, misinformation to these vaccines isn't new. I remember when we were having kids and a non-doctor had written a book and a lot of parents were wondering about whether or not they should get their vaccines and whether it had a direct tie to autism. And I remember the talking to doctors about it and them dispelling those myths. I think it's really important as we move forward that we get back to trusting those who have studied something for decades more than what we read that day on the internet. And I think it could be very concerning if people stop taking the other vaccines, because we could see the rise of 100-year pandemics that we have previously beaten, which would be horrific. So again, it's we got to reclaim reason and science and push out the craziness. Now, one thing is I think it would help if we stopped giving those that spread misinformation any oxygen. If they weren't on social media, if they didn't make the news, just no oxygen at all, because I do think some of what's being sought is attention. So those are my initial thoughts to a good question that we're going to have to think about and work out as we move forward. Joe Ragusa, Spectrum News.
Hi, Governor. So going back to the idea of the special session, I feel like you answered pretty much all of my potential questions about the specific bill that was put out, the $81 million bill. But kind of in line of that thinking, is there anything the state can do, whether it be, an alternate source of funding or maybe some other mechanism to encourage hiring or something else in that regard to kind of deal with this issue in the near term and possibly, needing a special session?
So where we are right now is aiding hospitals with National Guard, and I think every hospital you talk to is saying that's providing a huge lift, and that's providing a huge lift at no cost to them as well. Nursing students, again, more bodies, at least semi-trained individuals, no cost at all to them. Testing services, which we're taking over, freeing up their people, adding to their workforce, no cost to them at all. FEMA strike teams, the same. Recognizing doctors and nurses from other states. But we also need to look in the midterm about how we recruit more nurses specifically. And I think that there are some regulatory issues right now that are getting in the way. Maybe some steps that we can take in the short term to free up or recognize additional. Today, there was some thought about those that are in graduate programs that could be doing their graduate programs while still actively working because there's the training there. So I think there's a number of steps that we can take there. But what I know is I can't call a special session when no one's presented me a plan and the dollars that are being suggested don't exist. I think everybody would agree with that. And remember, sometimes a session can cause more harm than it does to help. And so even to the hospital systems, I'd say let's make sure that we know something is worth it, because types of legislation that could potentially come out could be harmful depending as well. All right, that's what we've got for today. Everybody out there, stay safe, mask up, get vaccinated. I never thought I would read that many names of 20-year-olds that have passed away in our communities. Those are kids. I know I wouldn't have liked being called a kid in my 20s, but I was. And so let's make sure we're doing what's required to protect them as well. And if you were in that 12, especially to 29 group, please get vaccinated. It's starting to hit you too. Thanks.